Your job is very different from most. Your office is your home. Your clients are just learning to walk and talk. Your success is based on their health and happiness, and your bonuses are hugs and smiles instead of a check. You do this job because you love children, and you take pride in doing it well. Because you are a professional, you worry about the health and safety of the children in your care. This videotape was created just for you. It focuses on many of the concerns you face every day and will help make your home daycare a safe and healthy place. And that will leave you more relaxed to enjoy the children's love, laughter, and curiosity. But take a look at your home from a child's point of view. There are hazards lurking everywhere. The first question is, why isn't someone watching this child? Well, you know that supervision prevents many injuries, so you wouldn't allow a child to do something dangerous like this. But the point is that what looks like a normal household is actually a hazardous play area for children, so you need to make sure that your house or apartment is as safe as it can be. How many things did you notice in the scenes you just saw that might have caused an injury, but could have easily been safe? Let's look again. Here on the table are some cigarettes, matches, and bite-sized cigarette butts, and on the floor an electrical cord to pull. It shouldn't be running under the rug, and it leads right to an outlet with no outlet covers. Another danger is the long dangling telephone cord. In the kitchen, this step stool leads to the top of the counter, and this hot pan is within easy reach. The cupboard is unlatched and full of colorful bottles and boxes, and oh yes, the door to the basement stairs is wide open. There are many, many items and places in your home that aren't meant for children, so you need to have a plan for making your home safe and for practicing healthy routines. Most injuries can be prevented by making simple changes around the house and supervising the children in your care. The combination of this videotape and the Family Daycare Health and Safety Checklist in your provider's kit, plus a little time and energy on your part, will give you such a plan. Watch the videotape once, from beginning to end, and then rewind the tape and watch it again while you use your checklist. Pause the tape after each section and complete that section of the checklist as you walk through your home. The checklist is much more detailed than the video and covers more items. If you can fix something right away, do it. Every item you can correct now is one less thing to worry about later on. Let's start with the big picture, your home itself. Once you decide to bring children into your home, you take on a responsibility that is different from raising a family. Your home is now an important part of your business, and keeping it in good shape is necessary for the health and safety of the children in your care. This section covers 3 areas: the condition of your home, out-of-bounds areas and objects, using guards and gates. In general, your home and the furniture in it should be in good repair. You may have already checked for hazards, such as loose railings or table legs, but have you looked at where your furniture is placed? Children love to climb and can use furniture as a stepladder to get at poisons or a sharp knife or fragile objects that you thought were out of reach. One area that should definitely be out of bounds for infants and toddlers is the bathroom. Children can drown as 1 inch of water, so never leave a pail of water around. Of course, the toilet always has water in it, so just close the lid and shut the bathroom door. You probably have closed off certain areas like the basement and the garage, but barricading some things, like wood stoves or older types of radiators, might require a more creative approach. Even open windows should be out of a child's reach, or they should open only from the top, or should have window guards installed. Gates make good barricades, and should always be used at the top and bottom of stairs. The kind of gate you use is important. Old-fashioned accordion-style gates are not safe. Children have hung themselves trying to squeeze through the openings. Now you may want to pause the tape and complete the Getting Started section of the checklist. Your home is full of everyday products and tools that might seriously harm a child. So this section of the video and the storage section on your checklist will help you to recognize the kinds of things to keep away from children and the best ways to store them. In general, store anything harmful above a 4-foot level and out of sight. Most kitchen counters are only 3 feet high, so on the counter isn't out of reach. A latch like this one for cabinet doors or drawers is essential when storage space is at children's level. But even the best latch isn't foolproof, so store your poisons out of reach. And wherever you store poisons, be sure to keep these substances in their original containers. Something like turpentine left in an old food container might invite a child to drink it. Consider how easily a child can confuse these look-alike containers. Even an adult might make a mistake if she didn't look closely. Poison substances, like cleansers, paint, alcoholic beverages, and medicines are obvious, but have you ever considered what's inside your own pocketbook? Many of these products are harmful if handled or swallowed by a child. The most common burn young children suffer is from hot liquids. Even a cup of coffee can cause a serious burn. You know to turn pot handles in when cooking, and not to leave coffee makers or crock pots on the edge of the counter. But do you have any idea how hot the water is coming out of your faucet? Run the water until it is really hot, then test it with a candy or meat thermometer. Higher than 120 degrees, lower the temperature at your hot water heater, and then recheck the temperature. Water at 140 degrees causes a third-degree burn in only 5 seconds, but 120-degree water takes a full 10 minutes to burn. Sharp objects also are easy to identify and put out of reach. If you have installed latches on drawers holding knives and other silverware, did you also put one on the drawer or cabinet where you keep plastic wraps and foil? The cutting edges on those boxes are razor sharp. One more category to think about is small objects like keys and balloons. Use the choke tube test as explained in your provider's kit in order to learn what could cause choking. Children frequently choke on foods too, such as hot dogs and grapes. In fact, hot dogs are the #1 cause of food choking and should always be cut lengthwise before serving. Grapes and other similar foods should be cut into halves or smaller. One final word about storage. You might think that products made for children would be absolutely safe, but in fact, their own toys can come apart or break and end up being dangerous. Toy chests can be a problem too. If you use one, remove the lid or make sure that it's lightweight and closes slowly so it can't cause head injury or suffocation. Sturdy, open shelving is a much better idea because children can see their toys and can help to pick up. Now you may want to pause the tape and complete the storage section of the checklist. When you care for infants and toddlers, you need some special equipment. And there are federal standards for new equipment which help make it safe. There are many details on your checklist, but above all, make sure that openings between crib rails are no more than 2 3/8 inches wide. Use a ruler, don't just guess. You probably can't believe that a child could squeeze through that narrow space. That's the problem. A child can get her body through, but her head won't fit, so the child could hang. Use your fingers to see how much room there is between the side of the crib and the mattress. This mattress fits properly. If you can get more than 2 fingers down between the mattress and the frame of the crib, then it doesn't fit snugly enough. A child could roll in there and suffocate. Always keep the sides up on the crib when a child is in it. And to preparation, remove any toys that stretch across the crib as soon as the child can sit up or pull himself up. Playpens, too, should always have the sides up to prevent suffocation. And keep checking for rips and tears in the mesh. The holes in the mesh shouldn't be any bigger than 1/4 of an inch to prevent buttons or clothing from catching there. In any case, only use the playpen for short periods of time, because if you've taken care of all the things on your checklist in the previous 2 sections, your home should be safe enough for supervised play and exploration. Walkers are convenient, but they are linked to more injuries than any other type of equipment. Children in walkers move fast and may bump into things with a lot of force. They can end up tipping over or falling downstairs and may be seriously injured. Now you may want to pause the tape and complete the infant-toddler care section of the checklist. Both you and the children enjoy time outside. Even in chilly weather, it is healthy to bring children outdoors. They need time and space to run and jump and climb. If they play in your yard, take a good look at everything there, both at things meant for them and things to keep away from them. Most of those are obvious: machines and vehicles, tools and chemicals. What might not be obvious are the hazards from their own play equipment. Look at the yard shown here and see how many hazards you can identify. Tools and machines are all put away, and there are lots of things for the children to play with. That's good. But here is a sand play area, and it's not covered. Animals use sand for a litter box, so cover the sandbox and rake the sand regularly. Wading pools are not recommended. They spread germs from child to child and are also a drowning hazard. A sprinkler would be a better idea. This swing set looks sturdy and in good repair. It has lightweight seats and plastic-covered chains. It is placed at least 6 feet away from other play equipment, sheds, fences, and walkways. But there's definitely a problem with the surface under the swing set. It only has a few inches of sand, which isn't deep enough to be safe. And did you know that dirt and grass are also unsafe surfaces for play equipment? They don't absorb the impact of a fall. Safe surfaces include sand or wood chips going 12 inches deep, or a commercial play surface. Now you may want to pause the tape and complete the outdoor play section of the checklist. You have a lot of responsibility in this job, and part of that responsibility includes preparing for an emergency so that you don't panic if one occurs. By now, you have taken action, both inside and outside, to reduce the risk of injury. But you will still want to plan for an emergency, just in case. The checklist includes many important steps to follow concerning smoke detectors, fire extinguishers, and first aid kits. Your kit should be portable so you can take it outside. One very necessary part of your planning should be to practice with the children. Make an emergency evacuation plan and practice how to leave your home safely and meet outside at a safe place. Post emergency phone numbers such as fire, police, hospital, ambulance, and poison center next to the phone. Post your own phone number and address, too, in case a child or a neighbor has to make the phone call. Now you may want to pause the tape and complete the emergency planning section of the checklist. You've been around children enough to know that an occasional cold or flu is to be expected. But you may be surprised at what you can do to cut down on the spread of germs. The simplest and most effective thing you can do is wash your hands. You probably already do this a lot, but the following method makes hand washing truly effective. First, always use running water and liquid soap. Rub all the surfaces of your hands briskly for 10 seconds. Let the water drip off your fingertips and then dry with a disposable paper towel or a cloth towel that only one person uses. Turn off faucets with a disposable towel so your hands won't touch any germs that might be on the faucet handles. A dab of hand lotion after washing will prevent chapped hands. For you and the children, when to wash is as important to remember as how to wash. Wash when children arrive and after they come in from outside. Wash before and after preparing or eating food. After using the toilet or changing diapers. After contact with body fluids such as blood, stool, urine, vomit, or mucus. After touching pets and after cleaning. That's a lot of hand washing in a day, but it's the best defense against infection. You can kill germs easily and cheaply with a homemade bleach solution. Mix 1 tablespoon of household bleach with 1 quart of water. Make it fresh every day and keep it in a spray bottle out of children's reach. Then, after cleaning off the dirt, wipe or spray high chairs, changing tables, tabletops, and even plastic toys with the solution and allow them to air dry. Another important procedure to follow is in diapering. Once again, you're very experienced at this, but just check to make sure that you remember all these steps. Diaper in an area separate from where you prepare or serve food. Use a waterproof changing surface with a disposable covering and throw the cover out after each diapering. Use your hand to restrain the child at all times. Use disposable wipes for cleaning. Use each wipe only once and wipe from front to back. Throw both the wipes and the diaper in a lined, covered pail. One that has a foot pedal is best. Clean the changing surface and spray or wipe it with the bleach solution. Then let air dry. And don't forget, wash your hands. Now you may want to pause the tape and complete the healthy routine section of the checklist. This completes the video portion of our program. If you have time right now, rewind the tape, get your checklist, and start to work through one section at a time. You might want to do just one section each day, because it will probably take a little while to actually go around your home to look for things and fix them. You know better than anyone that being a family daycare provider is not an easy job. This video and your checklist will help you do your job with more ease and less worry. And if you review this material regularly, it will help keep your home safe and healthy. It takes time and commitment to care for children in your home. But you've worked hard and should feel proud of your effort. The children in your care will benefit from your special attention.